All right, Kylie, thank you. Well, the financial toll that substance abuse takes on Hoosier families is immeasurable. It also has a big impact on the Indiana economy.
Our state and our way of life are at risk. Beset on all sides by an invisible but deadly force: addiction.
4 years ago, Indiana University unveiled its Grand Challenges Initiative, a strategy designed to increase efficiency, drive innovation, and apply new solutions that improve quality of life for Hoosiers in every corner of the state. That initiative focuses on precision health, the environment, and the addiction crisis. IU is partnering with Next Level Recovery Indiana to tackle the full scope of substance abuse across our state. What are the goals and why is it so critical for the state of Indiana? For some answers, we turn now to Next Level Recovery Executive Director Doug Huntsinger. And Doug, welcome to the program.
Thank you, Gary. Thanks for having me.
You know, there's been a lot said and written about the opioid crisis, substance abuse and substance use, and those big issues for the state, how critical it is. A big human toll, to be sure, also an economic toll on the state. As we begin our conversation, give us an idea. I mean, how substantial does this challenge continue to be?
Yeah, well, thanks to the work of some IU economists, we know that there is a $4 billion economic toll that this crisis has taken. And we know that COVID-19 has not made this any better. So we're really looking forward. And as the vaccine has begun to be rolled out, we're really looking at how we can get our treatment centers back online, back to full capacity, to ensure that we're doing everything we can to first and foremost treat people who are suffering with substance use disorder.
Yeah, Doug, I want to ask you about that, and that's the pandemic's impact on your efforts. What has that impact been?
Yeah, so back in April, we began to see our naloxone administrations with EMS and overdoses within emergency departments increase. And immediately we took action. We have dedicated $1 million that's funding 25,000 doses of naloxone. We've already distributed over 13,000 of those doses. And I would attribute that to why our overdose rate is not climbing at the same rate as that of our neighboring states.
Yeah, and you've mentioned, as we talked off camera before this interview, you talked a little bit about your mission, your focus as it relates to workforce changing just a little bit.
Yeah, you know, before COVID, we had record low unemployment, and our focus was really on, in the employer space, how can we get employers to ensure that their workforce is healthy, not just with the substance use disorder, but also with mental health, and ensuring that there was adequate treatment for those employees and pathways for employers to understand how to look for warning signs and how to create programs in which they could incentivize their employees to take advantage of treatment opportunities.
You've got big challenges. Big challenges, obviously, for you and others working on this challenge. The Grand Challenges Initiative at Indiana University presents you, or certainly has presented you, I think, with a unique tool to combat that. Talk about how this major research institution, with its Grand Challenges Initiative, how that's impacting your efforts.
Yeah, well, we were really happy that Indiana University came on board as a partner early on in our fight. You know, Governor Holcomb has made combating the drug epidemic a top priority, and IU's really brought their expertise in not just research, but in community development and those academics who are able to provide the analysis. You know, we often say around here that our best solutions are implemented and developed at the local level. And we're really here to facilitate that. So IU has done a wonderful job of convening people and providing experts all across the state in communities large and small as they look to help provide solutions and help communities combat the epidemic in their own backyard.
I know IU, and through its Grand Challenges Initiative, has made the point this is very much an initiative that is statewide, and that really couples up or coincides with this drug abuse, substance use challenge. It's a statewide initiative. It's not just rural communities, it's urban, rural communities of all sizes.
Absolutely. I'm really have the pleasure to serve on a research team with Dr. Matt Alsma, who they're looking at substance use disorder in the juvenile justice system. It's across 10 counties in the state, all varying degrees of population and resources. And their goal is really to begin to develop interventions and treatment modalities that can hopefully reduce recidivism. This is just one project in the larger, grand challenge that is going to have a really meaningful and lasting impact on our state.
Doug Huntsinger is the Executive Director of Next Level Recovery, and certainly an organization working closely with IU and its Grand Challenges Initiative to make a difference in Indiana. Doug, thanks for joining us, and thanks, too, for the work that you do.
Well, thanks for having me, Gary.